The information you will hear in this video has been prepared using the patient information leaflet to inform Singulair users. If you find this video helpful, don't forget to like it, join the channel and turn on notifications. Singulair belongs to the group of respiratory system medications. It is available in cardboard packages containing 28 chewable tablets, each with 4 milligrams. The active ingredient of the medicine is montelukast. You can find the list of excipients in the final part of the video. What is Singulair chewable tablet? Why is it used? This medicine belongs to a group called leukotriene receptor antagonists. Leukotrienes are substances in the body, especially in the lungs, that cause narrowing and swelling of the airways. Singulair reduces the effect of these substances, helping to prevent airway constriction. It helps control asthma symptoms and reduces the symptoms of allergic rhinitis, commonly known as hay fever. Singulair is mainly used in children. The 4 milligrams chewable tablet form can be prescribed by a doctor for children aged 2 to 5 for the treatment of asthma, seasonal allergic rhinitis, and for controlling year-round allergic rhinitis symptoms. Singulair is not used to stop an asthma attack suddenly. During an asthma attack, your doctor's recommended rescue inhaler should be used. Asthma is a long-term respiratory disease characterized by airway narrowing and inflammation. In asthma, the airways usually narrow. Swelling occurs in the airways. Excessive sensitivity to environmental factors develops. Factors such as cigarette smoke, pollen, cold air, or exercise can trigger asthma symptoms. The most common symptoms of asthma are coughing, wheezing, chest tightness, and shortness of breath. Allergic rhinitis is commonly known as hay fever. There are 2 types. The first type is seasonal allergic rhinitis, which usually occurs due to tree, grass, or weed pollens. The second type is perennial allergic rhinitis, which lasts all year round. This is usually caused by indoor allergens such as house dust mites, animal fur, and mold spores. How is Singulair used? You should always use this medicine exactly as prescribed by your doctor. For children aged 2 to 5, the medicine is usually taken once daily in the evening. Tablets should be chewed and not swallowed whole. The medicine should not be taken with food. It should be taken at least 1 hour before or 2 hours after a meal. It is important to take the medicine at the same time every day. Even if the child does not have asthma symptoms on a given day, treatment should continue as recommended by the doctor. Before using Singulair, the following precautions should be noted. If you are allergic to the active ingredient or any of the excipients, this medicine should not be used. If your child's asthma symptoms worsen, if shortness of breath increases, or if more frequent use of rescue inhalers is needed, you should contact your doctor immediately. Singulair may interact with some medications. Therefore, you should inform your doctor about all the medicines you are taking. Possible side effects of Singulair include the following. As with all medicines, some side effects may occur while using Singulair. The most common side effects are stomach pain, thirst, and headache. Less common side effects include diarrhea, nausea and vomiting, rash, fever, sleep disturbances, nightmares, irritability, nosebleeds, and muscle or joint pain. Rarely, severe allergic reactions, swelling of the face or throat, seizures, behavioral and mood changes, and liver inflammation may occur. If such serious symptoms appear, consult a doctor immediately. If this video was helpful, please like it and subscribe to the channel. Share your opinions and experiences regarding the use of the medicine in the comments section. Wishing you healthy days.